Good morning, dear student. In today's lecture, we will discuss some important points regarding to the uh, bismuth, that is the use of bismuth. So, in this case, we have to study this Helicobacter pylori. So, in previous lecture, we already discussed the chemistry of bismuth. So, in this lecture, we will discuss this Helicobacter pylori. What is this Helicobacter pylori, and what are the different complexes of citrate complexes of bismuth? So, what is this Helicobacter pylori? So, it is a type of bacteria. So, if you consider this Helicobacter uh, pylori, it is a type of bacteria. It is a type of bacteria. These germs, so they are considered as germs. So these are the bacteria. Okay, so these are the germs enter in your body. So they are enter in your body and live live in your digestive tract. So these are the type of the bacteria. So these are the germs enter in your body, lie in your digestive tract, and after many years they can cause sores called ulcer. So they cause sores called ulcer. So we are very much familiar with these ulcers in the lining of your stomach. So they cause ulcer in the lining of your stomach, in the lining of your stomach. So this Helicobacter pylori, it is a type of bacteria, enters in your body, live in your digestive tract, and causes sores called ulcer in the lining of your stomach. Uh, Symptoms. So if you have an ulcer, you may feel dull or burning pain in your belly. So uh, if you have an ulcer, it is one of the symptoms. Another symptoms, if you consider another symptoms, so in this case we can consider the symptoms for this gram positive Helicobacter pylori. That is, first, that is blotting. In Marathi it is called गोळा येणे. ओके, पोटामध्ये गोळा येतो, ब्लॉटिंग. सेकंड, that is burping, burping means ढेकर देणे, burping. Then third one is not feeling hungry. So these are the some symptoms: not feeling hungry, not feeling hungry, so भूक लागत नाही, not feeling hungry. Nausea, nausea, nausea means मळमळ. In Marathi it is called मळमळ. Then vomiting is there, and weight loss for no clear reason. So weight is loss. So these are the some symptoms of this gram positive. So if this bacteria enter in your body, so it will cause these symptoms, and the major symptoms is your ulcer. So what is the use of this bismuth? So if you consider this bismuth or bismuth complexes, this bismuth exert direct bactericidal effect on this bacteria by different ways. So this bismuth exerts direct exerts direct bactericidal effect bactericidal effect on this bacteria on this bacteria by different ways such as, so if you consider, so how they shows the activity against these bacteria. So they will forms complexes. So this bismuth forms complexes in the bacterial wall in the bacterial wall and periplasmic space. It will forms complexes in the bacterial wall and periplasmic space periplasmic space and inhibits. So it will forms complexes in the bacterial wall and periplasmic space, inhibits different inhibits different enzymes. So reduce the activity of different enzymes, inhibits different enzymes. Second, uh, ATP synthesis, inhibits different enzymes for ATP, uh, inhibits different enzymes, ATP synthesis, and adherence of the bacteria to the gastric mucosa. Adherence, to stop, we can say adherence of the bacteria, adherence of the bacteria to the gastric mucosa, gastric mucosa. So what is the role of this bismuth? So they will form complexes in the bacterial wall and periplasmic space, inhibits different enzymes, ATP synthesis, and adherence of the bacteria to the gastric mucosa. So this is all about this Helicobacter pylori. So you should remember, this is the bacteria. Okay, you should remember the symptoms. Okay, the major symptoms is ulcer, and then the other symptoms is also there, and the use of bismuth and how they reduce the activity of this bacteria. Again, if you consider, so we are very much interested in the bismuth complexes, different types of bismuth complexes, in which uh, we discuss first the citrate complex. So bismuth citrate complex. So the first complex is your bismuth citrate complex. First is your bismuth citrate. This bismuth citrate, if you consider this bismuth citrate, it having a molecular formula Bi C6H5O7. If you consider its appearance, it is a white powder. It is a white powder. If you consider its molecular weight, then it is 398.10 gram per mole. So if you consider its molecular weight, and then if you consider its property, it is insoluble in water or sparingly soluble in water, and it is used. So what is it used? It is used for hair dye. So these are the first this is the first complex, that is bismuth citrate. And if you consider its structure, it is like that: oxygen, this is your bismuth, again oxygen, double bond O is there. Okay, and this is the carbon, and there also one of the carbon. So OH is there, and double bond O is there, and it is attached to this bismuth. So this is your first bismuth citrate complex, that is bismuth citrate. It is used for hair dye. Again, three bismuth components. So we are very much interested in medicinal use of this bismuth citrate complex. So three important bismuth compound, that is bismuth subsalicylate, colloidal bismuth citrate, and ranitidine bismuth citrate are the medicinal use. So you should remember this name. That is, let us discuss the one by one. That is, first bismuth subsalicylate, subsalicylate, bismuth subsalicylate. Second, colloidal bismuth citrate, colloidal bismuth citrate. First, that is bismuth subsalicylate. Second, colloidal bismuth citrate. And third, that is ranitidine bismuth citrate, ranitidine bismuth citrate. So these are the three components. Okay, they are used. So they are extensively used to treat the gastrointestinal diseases, uh, including those related to the toxicity of this Helicobacter pylori, which cause gastric ulcers. So they are extensively used. So this bismuth subsalicylate, colloidal bismuth citrate, ranitidine bismuth citrate, they are used to treat the gastrointestinal disease such as gastric or peptic ulcer. We can say that gastric or peptic ulcer. Uh, Again, if you consider this bismuth subcitrate, another complex is there, that is bismuth subcitrate, bismuth subcitrate, and bismuth carbonate, bismuth subcitrate and bismuth carbonate. They are used in surgical dressing. They are used in surgical dressing. They are used in surgical dressing. So first three, they are used in the treatment of gastrointestinal diseases, and the second, the last two, that is bismuth subcitrate and bismuth carbonate, they are used in surgical dressing. If you consider the first one, that is bismuth subsalicylate, so we are discussing with this bismuth subsalicylate, it having a molecular formula C7H5BiO4, molecular formula C7H5BiO4. Again, if you consider its structure, it is look like this. Oxygen, here the bismuth is there, again here is a double bond O, and here is oxygen, bismuth. Okay, this is the structure of this bismuth subsalicylate. If you consider, it is used as an anti-diarrheal agent, anti-diarrheal agent, diarrheal agent. It is used for treatment of diarrhea, anti-diarrheal agent. It is how it is work. It work by decreasing the flow of fluid, by decreasing the flow of fluid in the bowel, in the bowel. Again it reduces the inflammation within intestine, reduces the inflammation within intestine intestine and kills the organism that causes the diarrhea. Okay, again, it is an antidiarrheal agent, so it will kills the organism or bacteria which causes diarrhea. So this is all about the citrate complex. We are not uh, interested in the detailed citrate complex. You should remember at least the names and their function, which complex is used, which bismuth complex is having medicinal use. So at least you should remember the name of these complexes and their function. In next lecture, we will discuss the remaining points of this chapter. Thank you.